Soundbytes. Quick clips, long-term learning.
This first case is a young woman who came to the ER with vaginal bleeding in early pregnancy. She had a positive pregnancy test at home and said that her last menstrual cycle was about 6 weeks ago. Emma, can you walk us through here what you're seeing, what sort of study they're doing?
Yeah, so it looks like here they're doing a abdominal ultrasound. Kind of see them starting through here. We have the uterus, and then we see the bladder there.
Mm-hmm.
In the uterus there, you see a sac of some sorts. It's not super well visualized.
Yeah. So there's something there probably in the uterus, but not really that well seen at this view. So let's go through a couple other images. Now they're transitioning to longitudinal view. So how do you get from that transverse view to longitudinal axis with your probe?
You'll just rotate your probe 90 degrees. Probe marker facing up.
Right, towards the patient's head. Perfect. So then they're fanning side to side and seeing more or less the same thing, right? Kind of hypoechoic sac there, but any other features that, are you convinced this is a intrauterine pregnancy?
No, I mean, it certainly could be, but it's not definitive at this point.
Yeah, so it could be early pregnancy, but kind of pregnancy of unknown location, threatened miscarriage, or completed miscarriage, or ectopic pregnancy. Of course, all still in the differential, so I think we need to get a little bit more information. So, Amelia, what are they looking at here?
We are looking at the right adnexa.
Mm-hmm. So why would you look for through the adnexa in this scenario?
Well, we want to make sure that we can rule out an ectopic pregnancy, see if there's any fluid around the adnexa.
Right. Yep. So are you seeing any sort of abnormal mass or anything within the right adnexa?
Not that I can see.
Yeah. Free fluid would be suspicious as well, but we're not really seeing that. And then they're going to move over to the left adnexa as well. Scanning through, we see some pelvic vessels circular here, some loops about in and out, but nothing like that's very obvious or concerning right now. So in order to get better views, Emma, what would you do next if you're not really convinced by the transabdominal ultrasound?
Yeah, I'd go to a transvaginal ultrasound.
Yep, perfect. So let's go to transvaginal. So now we're using the endocavitary probe, right? Because we can tell the change not just by the picture getting a lot better, but by the footprint here. So we're in sagittal view, meaning that the probe indicator is pointed up towards the ceiling, and they're fanning left to right on the patient's body, getting that sagittal view like you would on a CAT scan. And kind of walk us through what you're seeing here.
Yeah, so as you mentioned, we're seeing the uterus here, and you can see kind of that hypoechoic structure we saw in the other view, but this time you can actually see the yolk sac within that fluid cavity.
Yeah.
It looks like a little Cheerio. You can see that kind of popping up.
Perfect, yep. So the yolk sac is present. Let's freeze it right there. So we see that little, people call it a Cheerio, within the uterus. So this basically confirms that you have intrauterine pregnancy at this point, right?
Yes, it does.
Yep. So let's keep going through. These are really good quality images, I think. And it's a good job for the sonographer to go to transvaginal ultrasound as well. So here, just for teaching, we have the uterus kind of outlined here, all the way down, the cervix in this area right here. And IUP now within the uterus. So let's go through the sagittal view again, another view, seeing that yolk sac. Good. And then Amelia, what do you see here? What are they trying to demonstrate?
They're looking at fetal cardiac activity here.
Yep. So we can see where the fetus is here. It's very, very small, but this is the fetal pole right on this area. So this is the yolk sac, and then the fetal pole on one end of it sort of has that appearance. They call it kind of looks like a diamond ring almost, right? And you see that little fluttering inside of it. So that's the fetal heart tones. I'll say in this case, they weren't able to get like a M mode tracing of the fetal heart rate just because I think it was too small or just too difficult to capture. But in that scenario, you can just take a video clip like they've done just to demonstrate fetal cardiac activity. So Amelia, what are they showing in this still image here?
So they are measuring the crown to rump length. So you can see it measures about 0.23 centimeters, which puts us at about a 5-week, 5-day pregnancy.
Yep, good. And that's pretty consistent with the dates she told us, right? With last menstrual cycle being about 6 weeks ago. And just note that they are measuring this correctly. They did a good job of excluding the yolk sac. I've seen a lot of times they include the yolk sac. It's going to give you way different measurements, but you just want to include just this fetal pole area here. Great job. So then we're going to switch to a coronal view. So in order to get this, how do you go from sagittal to coronal, Emma?
For sagittal, your probe indicator is facing up. For this one, you're just going to rotate your hand 90 degrees so the probe indicator is pointing towards the patient's right.
Correct. Perfect. And then they're scanning, moving their hand up toward the ceiling and then down towards the floor to scan through the whole uterus. And we're again demonstrating that fetal pole on that yolk sac there. And then we can see some views of the adnexa. We see a lot more clearly this time, right? We couldn't really see the ovaries or anything during the last transabdominal view. But now at the beginning of this clip, we can see the ovary here. Okay, what snack does that remind you of?
Looks like a good chocolate chip cookie to
Yeah,
me.
not to me, but that's what people say. Yeah. So yes, so it kind of has that chocolate chip appearance, and the anechoic areas within that are because of the follicles, right? And that's what gives it the chocolate chip appearance. And then we go through the left adnexa too. And we see at the beginning, very beginning of the clip, we can see the left ovary, which looks normal. So overall, I think this is a great pregnancy scan. Great job for the sonographers from switching from transabdominal to transvaginal, demonstrating an IUP. But we just want to counsel the patient. Emergency ultrasound is generally for limited indications, right? We're just confirming IUP, and by way of doing that, basically excluding ectopic pregnancy. In the setting of vaginal bleeding, it still could be a threatened miscarriage. So you don't want to give too much reassurance and say that everything's completely normal with the pregnancy, but right now, a lot of the emergent conditions have been ruled out related to pregnancy.
Soundbytes. Quick clips, long-term learning. This soundbite is a shorter, digestible segment taken from our monthly Soundcheck podcast. For the full episode, check out the podcast on YouTube at youtube.com/MedStar Emergency Physicians or visit mepsono.com.